Pay close attention. The news you're about to see is fulfilling Bible prophecy.
Welcome to another edition of YPN News, bringing you the news that relates to Bible prophecy and foretold by Yeshua Hawkins. Well, in the news today, we're going to look back at, actually take our viewers through a timeline of the developments pertaining to the coronavirus since the Thanksgiving holiday and then up to the current right now, and see just how much this virus has taken off. Well, we're going to start off with Britain's Prime Minister, Boris Johnson, is pleading with his citizens to follow the country's guidelines set in place to help stop the spread of coronavirus. In a recent statement to the public, he said, "What we want to avoid is relaxing now too much and taking our foot off the throat of the beast."
Interesting. But lockdown rules are being met with opposition as protesters march through London streets voicing their frustrations. They are tired of local businesses being shut down and social gatherings being canceled.
Well, one of America's drug companies, Moderna, is asking for emergency authorization of their vaccine. Following in drug maker Pfizer's footsteps, they are only the second company to seek FDA approval. Moderna says their vaccine is more than 94% effective, and between them and Pfizer, they will have 20 million doses ready to go by the end of December.
Well, the U.S. General in charge of vaccine distribution predicts that 100% of Americans who want the vaccine will have it by June of 2021. Alex Azar, Secretary for Health and Human Services, also reports that most elderly living in nursing homes, along with doctors and nurses on the front lines, will already have their shots by the end of this year.
Well, but regardless of everyone's efforts, public officials are sounding alarms because the virus is spreading faster than ever, infecting 4 million Americans in November alone. Now, that is 1/3 of the total cases in the U.S. since the start of the pandemic. Dr. Anthony Fauci now says the country is experiencing a surge on top of a surge.
People are waiting in lines miles long for testing after Thanksgiving, but top health officials are warning if you've traveled for the holiday, you should assume you have COVID and take the necessary precautions.
Well, hospitals continue to feel the pressure with over 93,000 COVID patients across the country in just 4 days after the American holiday. Now, New York Governor Andrew Cuomo calls hospitals the new battlefield and is pleading for doctors and nurses to come out of retirement so that more beds can be provided for new cases.
Wow. Well, Rhode Island says their hospitals are completely full. On the West Coast, Los Angeles County has closed playgrounds, limited the number of shoppers in stores, and prohibiting all social gatherings no matter what the size, even if they're held outdoors.
Well, two growing hotspots in the nation's heartland, South Dakota and Indiana, now have the highest COVID hospitalization rates per capita in the country. And while the virus wages war on South Dakotans, some are fighting back, arguing they can't spread a disease they don't have, and are questioning when the government got to decide what they need to wear, mainly referring to the mask, because some people just don't want to put a mask on.
Yeah, some people absolutely refuse to. Even like we mentioned, a few broadcasts ago, even after they come out of, being intubated, they're still not believing coronavirus and how serious it is. That's pretty sad. Well, CBS Evening News spoke to one doctor in Hammond, Indiana, which is located close to Chicago. Dr. Scott Samlin was first interviewed back at the start of the pandemic, making the comment that fighting COVID found him more scared than he'd ever been as an ER doctor. Now, of course, it's 9 months later, and Dr. Samlin says, "We're still at it. I'm emotionally and mentally fatigued and physically. I think everybody is." Well, Indiana is almost quadrupled. It has almost quadrupled its hospitalizations in the last 2 months, setting another record.
Well, from rural states like South Dakota and Missouri to urban ones like Florida and New York, and all across the country, it is becoming a dire situation. Now, Florida just reached 1 million cases of coronavirus, and 1 in 4 people in South Dakota know someone who has died as a result of contracting the virus. Now, according to the COVID tracking project, California's new average cases and deaths have both increased above 50% in the last 2 weeks.
Wow. Just getting worse there, with ICUs reaching max capacity and healthcare workers feeling helpless and overwhelmed. Dr. Fauci has given a serious warning, saying, I think if you start to see overrunning of your hospitals and your healthcare systems, I can assure you that there will be serious consideration for lockdowns.
Well, on December 2nd, the director of the Centers for Disease Control gave a frightening prediction, stating that as many as 450,000 Americans could die from COVID by February. Now, Dr. Robert Redfield said December and January and February are going to be rough times. And this announcement comes as Operation Warp Speed says it should be ready to start delivering vaccinations in less than 2 weeks now.
Now, Great Britain is jumping ahead at an even more rapid pace. Leaders there approved Pfizer's vaccine on the 2nd and plan to start administering shots in a few days. The FDA commissioner reportedly has told CBS News the U.S. will take longer to approve the vaccine in an effort to help Americans feel assured it is safe.
But some experts are saying regardless of the vaccine timeline, the damage has already been done by thousands of Americans who traveled during Thanksgiving. For December 2nd, the number of reported COVID infections nationwide was up past 13,881,600, and the death toll had reached more than 272,800, according to Johns Hopkins University.
Well, there are more than 180,000 new cases a day now in the U.S., which is double that of just 1 month ago, and no one is expecting the curve to flatten anytime soon. Now the CDC is once again asking Americans to stay home for the next holiday in an effort to slow down the spread. It is also making a change to how long a person should quarantine if they are exposed to someone who has the virus. So they are making a big change here, lowering the length of isolation from 14 days down to 7 days.
Well, Katana, as we continue to see the records being broken now on a daily basis with new cases being reported and the deaths both increasing, we're now going to turn to our field correspondent, Larry McGee, who has some more of these horrifying statistics for us. Larry, what do you have?
Now that it has thawed, reawakened, and reemerged in search for its host, there seems to be little that can be done to stop the coronavirus from homing in on and locating certain sectors of the population. To the horror of every nation, its energy now appears to be increasing with each passing day, as can be measured by the numbers of those newly infected, which can also be seen as a measure of its vigor and revitalization. Leading analysts in the U.S. are now announcing that the country is in COVID hell as America continues to set and shatter records for daily infection. Evidence of a generalized weakened immunological state within the nation is continuing to show as well, with some estimating one person to be dead every 30 seconds due to complications stemming from co-infections. For this and the unsustainable burden that places on the state's healthcare systems, some governors are now considering reclosing. With all of the year's turmoil due to the rebirth of the plague and all of its accompanying distresses, some are calling 2020 the worst year on record. Just 5 days into the 12th Roman month, and the U.S. is already reporting 1 million new cases. One inpatient nurse described the situation as out of control, as hospitalizations spiked following the large numbers of those who chose to mark the Thanksgiving holiday over the objection of government officials. Some hospitals are so taxed that they are actually converting their lobbies into COVID wards, as emotionally exhausted doctors tearfully announce the numbers of those they have been unable to save. In an increasing number of cases, the healthcare officials are in need of saving themselves, however, as they become infected, trying to assist those who are infected. In an effort to assist with gaining an accurate perspective on the action of the virus, analysts are likening its progression to a forest on fire, with hospitals using their parking garages to house patients, and Catholic priests being assigned full-time duty, ushering their dying into the grave with final rites. The nation's citizens who were hoping for relief with the arrival of a vaccine for the plague are now receiving a grave disappointment, however, as health officials announced that the alleged benefits for vaccination won't become apparent for months after inoculation begins. Until then, they say, with hospitalizations jumping as high as 300% in some areas, it is behavior which must change. For YPN News, I'm Larry McGee. Katan Jeff, back to you.
Yeah, that's sad. These are records that no one is liking to see being broken. And, you know, when hospitals are built, they're built with the expectation that they're going to receive a certain amount of clientele within a particular community. But now they're, as he was talking about, on the brink because they're overrun with so many COVID cases. Their ICUs are overwhelmed. Then you take into the fact that the nurses and the doctors are having a difficult time. It just makes it for an all really bad situation for everybody.
And as one reporter said, we're now in COVID hell.
COVID hell, that's right.
And only getting worse.
That's right. Sadly, but true. Well, the White House Coronavirus Task Force has warned that the first round of vaccinations won't be enough to stop the spread of the virus, and that masking up and social distancing is still a crucial to hold on to throughout the winter months. Now, in a statement, the task force said the current vaccine implementation will not substantially reduce viral spread, hospitalizations, or fatalities until 100 million Americans are immunized. Well, until then, they say that behavior must change.
Well, 80% of U.S. countries saw more people traveling this Thanksgiving than last year. Now, Dr. Scott Samlin, an emergency room doctor, said that people are on ventilators, people are dying, there's no end, and there's really no way for healthcare workers to really decompress. Now, more than a third of Americans are living near hospitals that are critically short of ICU beds. Now, California currently has 11,000 people hospitalized and more than 30,000 new cases, both of these all-time records.
Wow. Now, COVID-19 has also taken a huge toll on the Latino population due to jobs in agriculture, construction, and meatpacking. In LA County alone, the number of hospitalizations has jumped more than 300% in the last month.
Well, December 10th brought with it 227,339 new COVID cases and over 3,000 deaths related to COVID, a new record. Now, the new highest single-day total. Hospitals like Methodist Hospital near Minneapolis are seeing that surge in deaths, people dying alone without the comfort of being near someone they care about, leaving that void up to the nurses and the doctors to fill in. As one said, you know, they're just holding their hand as they're dying because they can't have any loved ones there in the room with them. So, as I said, they're the doctors and the nurses filling that void. Now, the CDC is forecasting up to 362,000 deaths by January 2nd, 2021. That's almost the population of Cleveland. Now, while hospitals are setting up makeshift ICU, coronavirus is spreading like a wind-fueled fire.
Well, December 11th saw 246,761 new cases, and the hopes of many that the FDA will soon authorize emergency use of Pfizer's new coronavirus vaccine. Now, this move after the White House pressured the agency to speed up the process. In fact, the president's chief of staff has told the head of the FDA, Stephen Hahn, to sign off on the vaccine now or hand in your resignation. Now, that was according to CBS News. Now, this among plans for Pfizer and the federal government is to start shipping more than 3 million freezing cold vials of the vaccine to more than 600 sites across the country.
Well, while hospitals await the vaccines, they continue to overflow with patients as the nation sees its highest week of COVID-19 cases, with 1,471,405 new cases in the last 7 days, and nearly 16,000 Americans have died in just the last week. While it'll likely take months for the vaccines to roll out on a large scale, cities are imposing drastic new restrictions amidst the virus crisis.
But just how effective is that vaccine against future transmission? Well, the CEO of Pfizer was asked that in an interview with NBC News. He was questioned, even though I've had the protection, referring to the vaccine, am I still able to transmit it to other people? Well, Pfizer's CEO responded by saying, I think this is something that needs to be examined. We are not certain about that right now. Well, the UK was excited for being the first country to approve Pfizer's vaccine, but that excitement is bittersweet as now they feel more like a guinea pig with a vaccine that's not guaranteed to prevent carrying or transmission of the virus.
Right, and that type of answer is not going to give people the confidence that that they're hoping to find with this vaccine, but it's not going to be there.
That's right.
Well, so the UK is now warning its citizens. The Medicines and Healthcare Products Regulatory Agency put out a statement regarding Pfizer's new vaccine, saying any person with a history of significant allergic reaction to a vaccine, medicine, or food should not receive the Pfizer BioNTech vaccine. Now, many are asking, how could such a severe reaction be missed during the clinical trials of thousands of people? Well, 2 nurses had severe allergic reactions on the first day of the first dose, because it's a 2-part vaccine. So that was the very first part of the vaccine. They received they had allergic reaction to it when they started doing the public.
Yeah, wow. Now that's pretty scary because you know, I know they do these trials and then there are some side effects, but you know, there's severe allergies. You know, a lot of people have allergies to medicine, so it would be bad to find out after you get the vaccine, especially with the side effects that are accompanied with the vaccine. It says it was already known that the vaccine could cause pain, headaches, fatigue, fever, swelling, and that's kind of common with a lot of vaccines, but potentially it can also cause facial paralysis. That's right. According to a briefing by the U.S. Food and Drug Administration, among non-serious, unsolicited adverse events, there was a numerical imbalance of 4 cases of Bell's palsy in the vaccine group compared with no cases in the placebo group. Though the 4 cases in the vaccine group, the statement continues, do not represent a frequency above that expected in the general population, but it's still there nonetheless.
Right. Well, while the press sold the vaccine as safe for all and was praised by a number of professionals in the healthcare area, the U.S. FDA uncovered some interesting findings in a report on the vaccine trials. They said a total of 6 of the enrolled participants died during the reporting period. Now, all deaths represent events that occur in the general population of the age groups where they occurred at a similar rate. So while they were testing the vaccine, they did have 6 of the participants die from taking the vaccine.
So in effect, they're really actually saying that they expect within the general population that many amount of deaths as was in the trial.
That's correct.
Interesting. Well, sadly, these findings weren't reported by the company that manufactured the vaccine, Pfizer, but the United States FDA, an organization that is responsible for giving the go for use in the general population. Well, needless to say, these latest findings are leaving some people even more uncertain as to the safety of getting a vaccine that's not guaranteed to prevent transmission, could give you permanent facial paralysis, or even kill you.
And with the, you know, we talked a little bit about the allergies. It might have been, you know, 50, 60, 70 years ago, it probably wasn't that common to have food allergies or allergies, but today a lot of people they're allergic to something, whether it be food or, you know, other type of allergy. So that's going to rule out quite a few right off the bat. But then, as you said, the facial paralysis, the death, it's really a gamble especially when they're saying it might not even prevent the spread.
Yeah, yeah, and then like we brought out so many times before, with the food. I mean, so many things over the last 20 or 30 years has been genetically modified. So that's changed a lot of things within people's bodies. Where, like you said, 50 years ago, people weren't allergic to things. Now they're severely allergic to things to the point that they can actually go into anaphylactic shock and even die as a result. So COVID-19 is kind of like that proverbial icing on the cake in regards to existing conditions that people have, kind of bringing those things to the surface and bringing about their demise, as it were. So will the vaccine work? So far, they haven't really made their case, and a lot of people are on the fence as to whether it's something that they're willing to risk getting, seeing as though the side effects with the vaccine can sometimes seem a lot more worse than just getting the virus itself. Well, if you're wondering what you can do, of course, to not only just protect yourself from this virus, but protect yourself from the greater things that are yet to come, including nuclear destruction that is on the horizon. We can't forget about that, as that doomsday clock was moving a lot closer to midnight. Contact the House of Yahweh, and when you do, don't forget to request your free copy of the Prophetic Word magazine and the monthly newsletter. Here's how.
To contact the House of Yahweh, you can write them at the House of Yahweh, P.O. Box 2498, Abilene, Texas 79604. You can call them at 1-800-613-9494. Visit them on any of their websites by going to yahweh.com, yisraelhawkins.com, or yahwehsbranch.com. You can also visit our website by going to ypnnews.com. If you would like to email the House of Yahweh, you can email them at info@yahweh.com. For any international calls, you can call the number that's on your screen now. And once again, don't forget to check out the Yisrael Says program by going to yisraelsays.com and the Ask Yisrael program by going to askyisrael.com.
Well, they say sometimes that an ounce of prevention is worth more than a pound of cure. Well, stay tuned, because Yisrael Hawkins is going to be bringing you the laws that will actually prevent you from getting these deadly diseases in the first place. From all of us here at YPN News, I'm Katan Alexander.
And I'm Jeffrey Heimerman.
Thank you for watching.